Mask usage, sanitization and hand hygiene. In the COVID-19 pandemic era, this has become a part and parcel of our life. We would be discussing today some facts and myths regarding these issues. So, in my previous upload, I had talked about masks, and there came numerous queries about something which is very important. I thought I should clear it out. This is a mask with an expiratory valve. This is an expiratory valve. This is a N95 mask with an expiratory valve. N95 is the material. This is an expiratory valve. So during pandemic times, WHO directives clearly state that such masks having expiratory valves should not be used, because this allows the exhaled air to go out, and somebody, if he or she is COVID positive, may just give his infection to others due to the fact that the exhaled air will come out through the expiratory valve. N95 mask or surgical mask for the common man. This is another commonly asked questions. There used to be long queues in the beginning to get N95 masks, and N95 masks were not available in majority of the shops, and there was an artificial crisis. It has been clearly clarified that under no circumstances does the common man require N95 mask. But this is a surgical mask. If somebody is taking care of a COVID-19 patient or is sharing space with him in a home quarantine, then he needs to use this surgical mask, which is a disposable single-use mask. Can fabric mask be used both ways? Now, well, we are not going out, but still, fashion doesn't run out of blood. There are people who buy masks of this sort. This is a single colored, and when you turn it, it becomes a checkered mask, and some companies are even promoting that both-way masks. But as I discussed in the earlier upload, that this is a hydrophobic layer which should be on the outer layer, and this is a hydrophilic layer which is the inner layer. So a mask cannot be worn inside out, cannot and should not be worn inside out, and there is no way we can have a mask which is usable both ways if you go by the guidelines. Now let us come to the thing called sanitization. This is what we do every now and then, whether we require it or we don't require it. So let us be very clear that whether sanitization is done with sodium hypochlorite solution or hydrogen peroxide, these chemicals are harmful for the skin and internal organs and should not be touched without. This is a hand hygiene material. Sanitization here, I mean the sprays that are given in the open spaces and offices and the common place. So the people should not be exposed to that sprays without the protective gloves and appropriate apparels. Disinfectant spraying on all surfaces, does it work? We all were horrified to see that a bus of, the migrant laborers were entering into UP, and on them there was this disinfectant spray. In mid-May 2020, it can be definitely said after the WHO declaration that disinfectant spraying is ineffective and is dangerous. It can generate considerable trouble when residue is indirectly transmitted to us via food or drinking water. Hence, sanitization chambers or tunnel using such material sprays are also ineffective. In fact, it has been found out that if a COVID positive patient is made to work through a tunnel sanitization chamber, even after walking through that and coming out, he continues to spray the virus. Another common thing is the use of soap, sanitizer to clean groceries. Does it really work? It is not recommended and is in fact a bad idea. Even after cleaning them with water thoroughly, the chemicals can stick onto them and thus enter your body to bring about deleterious effects. Washing vegetables in warm water and cooking them in thoroughly is good enough. Soap or sanitizer, how much to use? A few drops of sanitizer, as I demonstrated, are only needed to properly disinfect our hands. Applying more doesn't clean more, nor does it make the sanitization effect last longer. However, these are chemicals, and moisturizing after each wash is important. Cleaning your hands. What are the tips? If your hand is visibly dirty, you would need 0 to 60 seconds cleaning with 40 to 60 seconds, with soap and water. Cleaning hands which are not visibly dirty, you should clean it with soap and water for 20 seconds. If facilities do not exist for cleaning with soap and water, then use the hand sanitizer. But remember the forgotten areas, those are the back of the palms, the web of the fingers, and the tip of the nails, which we forget to scrub. So these three areas, back of the palm, tip of the fingers, and the web of the fingers. These are to be paid attention to. So once we use a hand sanitizer, let's say 3 ml of this hand sanitizer, when can we touch it? Any other thing? We have to dry our hands completely before touching any other surface. We can wipe it dry with a clean single-use towel, or we can also air dry, or we can use the warm air from the machine generated air. But before touching somebody else's skin or food products, the hands should be dried completely. We should not go near naked flame after using hand sanitizer before it has dried up, as it is highly inflammable. Usually a hand sanitizer like this is a composition of 2:1 ratio of alcohol and aloe vera gel, and if alcohol is used, it is usually 80% ethanol or 75% isopropyl alcohol, and the alcohol content by volume should be 60% of the entire volume of the sanitizer. If it is less, no matter however more we use and however frequently use, it will not kill all the germs. So, for today, this much, and I think it will help to clear some doubts. If we have some more queries coming in, we would possibly address them in our next upload. Thank you, and stay safe during the COVID pandemic.